SBIRT stands for Screening, Brief Intervention, and Referral to Treatment, and it's a public health model.
Someone should be able to screen you, talk to you about what are your levels of substance use and whether or not those are risky, and then provide a brief intervention which could enhance your motivation, and then provide a referral to treatment, which can be so simple as giving you information. It doesn't necessarily have to be going to rehab or going to formal treatment.
SBIRT, so Screening, Brief Intervention, and Referral to Treatment, really is a public health model, and it's a harm reduction model. You know, the approach of SBIRT is not that you need to stop drinking alcohol altogether, but that you might consider drinking and using alcohol within sort of what has been determined to be the safe limits, or the not so risky limits for alcohol use.
But I think that's a model that takes a public health approach to substance use, which is that lots of people use substances. How can we talk about it better, and how can we get people help if they need it?
It's another screening, because in healthcare settings, for instance, they do all kinds of screening. You know, you go into the doctor, they put you on the scale, that's a screen. They take your blood pressure, that's a screen. So the idea that we could do or ask people some questions about their alcohol and drug use kind of fits into that model.
It's actually been around since the early 80s. The World Health Organization and other national organizations were looking at reducing risky use around alcohol. And there were a couple small-scale studies that showed if doctors continuously talk to their patients, just brief conversations about reducing alcohol use, that people were able to make those health decisions and use in a less risky way. And so they began looking at specific screens to validate them around alcohol use. And that initiative grew really primarily because of the endorsement of the World Health Organization. And then in the United States, the SBIRT was championed by SAMHSA, the Substance Abuse and Mental Health Services Administration, and they began to fund, probably in 2003, large-scale SBIRT projects. And so that from then it's grown. So it's over a decade long, at least here in the US, and even longer if you go back.
Recently, in fact last week, I did a training with school personnel, both people who work in schools as counselors, people who are involved in student assistance program teams, and school nurses were also part of the training. So school people are interested in SBIRT. I've also worked a little bit with people who are the pastors and pastoral counseling. SBIRT is a good tool. If you're doing counseling with your parishioners, it's probably a good idea to ask them a little bit about substance use. Also mental health counselors, as I mentioned, are also a group that I've talked to in the past.
The nice thing about SBIRT is anybody can do SBIRT. I mean, anybody can be, you don't have to be a healthcare professional. You don't have to be a mental health professional to understand the concepts and to apply them with any population.
So it's a pretty wide variety of folks who I think can find SBIRT a useful tool.